Well, April is National Child Abuse Prevention Month, and this morning Dr. Mary Palmer from East Tennessee Children's Hospital is discussing how to recognize the signs of child abuse and how to report it. Good morning.
Good morning.
Thank you for being here.
Well, thank you for having me.
The color to help show awareness for this serious issue is blue.
It is.
Royal
It's a great
blue.
color. Yes.
And we are both dressed appropriately this morning.
Yes.
Okay, let's talk a little bit about why this month dedicated to child abuse prevention is so important.
Well, all of us are at risk of harming and neglecting our children. And I think that's the important thing for us to remember and work together to prevent. Every person is human, and we're entrusted with these tiny lives, sometimes at times in our life when we're not quite ready for it. And we don't have the resources to support and help us with that. So that's why April's Prevention Month.
We were talking during the commercial break about child abuse, and I said, what are the things you look out for, like broken bones, bruises, things like that? That is the most obvious sign, but there are other signs of child abuse as well.
Correct. The most common cause of abuse and neglect is actually neglect, emotional and physical neglect. But it can advance into other features. I think that most people don't intend to abuse or neglect their child. It's the circumstances that they find themselves in. So that's why we're focused on that.
How do you tell if somebody is dealing with neglect?
We look at a child when they come to the hospital or come to the doctor's office, or if you see them in the community. We should all be looking for children who seem to be undergrown, seem to be underfed, may be in a circumstance the family is in where it's obvious that they're having difficulty dealing with their child. But when a child comes to the ER, we kind of keep it in the background of our thoughts as a potential diagnosis, just as if you have belly pain, the most common causes of belly pain actually are constipation and viral illness. But the most worrisome thing for us as parents and physicians are things that may require a surgery, such as appendicitis. So it's that kind of looking at the whole picture to make sure that we address every need of the child and family.
Physical abuse, some warning signs for this?
Bruises in places that are not normal for normal activity, bruises especially on the head and neck, and then multiple broken bones at different stages of healing particularly, and a baby that's not acting appropriately, that's vomiting, that's listless, those sort of things can mean something's gone on.
Some things we should look out for as far as sexual abuse is concerned.
Sexual abuse is a real hard one because it's so pervasive, and changes in behavior, extraordinary fear, over attention to sexual features at an age that's not appropriate. So say a 10-year-old that's much more interested in those sort of things than you would expect at that age. Those sort of features are concerning.
Let's talk about emotional abuse. This is another one that's probably hard to pinpoint.
Yes, it is, because our emotional needs are so widespread, and it's difficult to assess that. But to find yourself demeaning someone at a point when you should be correcting them as a parent is one of the biggest things. And then if you see people in the store particularly, I think this is where we all think of it, where you see anger coming out at times that is inappropriate.
Okay, this is a big question, so we've got to sum it up in about 20 seconds because we're almost out of time. How can you help if you see signs of this going on?
The biggest thing I think is to, again, prevention. So you want to be as involved in your community and the activities of your child and other people as you possibly can to provide support. If you see something that's happening that you find concerning, you should report it to the Child Abuse Hotline, and that's easily found throughout our community on the web. And those reports can be made anonymously, and that anonymity is protected even if you give your name.
Oh, okay. Well, thank you so much for coming on and talking about this.
Thank you so much for having me.